Very good afternoon. In my presentation, a novel application for rapid diagnosis and triage of stroke patients in Bangladesh. I'm Mubir Maqbul from Dhaka Medical College Hospital, and a very welcome to my presentation from my institution, Dhaka Medical College Hospital. And I'm currently doing my research works at the Department of Neurosurgery at Dhaka Medical College Hospital. Before starting my presentation, I will start with a very saddening slide. A few years back, we got these 6 patients, and all these 6 patients are from the same family, and all these 6 patients have died of the same disease. And I think you have already guessed what is the disease. Seeing my title, the disease is stroke. So what is a stroke? Actually, we all know about heart attack, but if I make it simplified, stroke is like a brain attack. What is this? In the brain, we have a lot of blood vessels. So the blood vessels can be narrowed either by fats or by calciums or by cholesterols, so that the blood vessels get narrowed or blocked. And our brain is very much viable to lack of blood supply. So when the blood vessel is blocked, some areas of the brain do not get its necessary blood supply. As a result, some areas of the brain dies. It is a type of a stroke. We call it ischemic stroke. There are another type of a stroke where the blood vessel of the brain ruptures. Vessel ruptures. We call it hemorrhage. And it is also a type of stroke. And as the brain doesn't get enough blood, it dies. And if I make it a bit simplified, if I show an animation, we can see here a brain, and this is the blood supply of the brain. We call it circle of Willis. And if you see, there is an area yellow, and there is some fat. Fat will deposit in that area, and it will ultimately block the blood vessel, and ultimately it will cause the death of some areas of the brain. A large clot has been formed and the vessel has been blocked. Actually, it is a common representation of stroke, and the brain eventually dies. So researchers showed us that in every minute, about 2 million brain cells die. Can you imagine? And our brain is vulnerable to less oxygen, or what we call hypoxia, more than heart. Heart can survive a bit longer, but brain can survive a less than heart. And if a patient of a stroke comes to us, the initial CT scan may show like this. And the second image are postmortem image. Second and third, both are postmortem images. The second one is ischemic stroke, where the areas of the brain died or dead. There is a hollow gap. And the third image is also postmortem image, is a hemorrhagic type, where the blood ruptured, and you can see the blackish hemorrhage or blood leaking out. So what is the epidemiological study, or what is the epidemiological data in Bangladesh, or in our perspective? In Bangladesh, stroke is the 3rd leading cause of death, and it is 2nd leading cause of disability after accidents. What does it mean? If you have a severe stroke, you will die immediately. But if you get a stroke a bit mild, you will suffer from paralysis in your whole life till death. That means after road accident, it is the 2nd leading cause of disability in Bangladesh, and 3rd leading cause of death. And the overall prevalence is around 11.3, I can say 12 per 1,000 adult population. And our statistics is similar to India, a bit higher than Sri Lanka, but lower than Pakistan, because Pakistan is very much, they live on meat, they do not eat vegetables. This is a global data. This slide is very interesting and very important to understand the disease burden. WHO estimates by 2050, 80% stroke deaths would occur in middle and lower middle income country. I think everybody will ask me, what do you say? 80% death in middle and lower middle income country? How it's possible? Actually, there is a game of technology. see the next slide. This is the drug. We call it Altiplace. It is a clot buster. When there's a clot, if you inject this drug, it immediately bursts the clot and the circulation is reestablished and the brain is totally cured. But there's a problem. The problem is this drug has to be injected within 4.5 hours from the beginning of the stroke. You have only 4.5 hours from the stroke onset to the injecting of the drug. So in the modern world, in the high-income countries, they already know it. When they have a stroke, they call 999. They get helicopter evacuation. They go to the nearby hospital. They immediately go with this injection, and they immediately get cured. But the problem is in these countries, these lower middle income countries, these low income countries, we do not have such facilities. And the consensus by the American Heart Association, they also, this is a journal finding, they also say that you only have 4.5 hours to inject this drug. And how does this drug occur? This act. So when there is a clot, that drug goes, I have used some animation. It's like a clot buster. I'm not going to this biological mechanism, how the clot bursting occurs, but immediately it bursts the clots and circulation is reestablished. But in Bangladesh, we do not have this. So it is a common scenario, common poster in UK, US, all the high income countries, because they know stroke has three major signs. We call it FAST. F for facial weakness. That means you will say one side of your face has gone down, facial asymmetry. Then arm weakness, you cannot raise your one arm or hand or both arms. Then speech problems, you cannot talk properly, your speech get entangled. And when they have it, they call 999. But we do not have that level of public awareness to call 999 or to get the service. And there's a lot of problems. Even if you imagine in Bangladesh, if you get a stroke in Mymensingh, to come in Dhaka, you will already lose 4.5 hours in the traffic jam. So this is the game changer. This is the problem in our Bangladesh in stroke care. And more interestingly, what you've seen in Bangladesh, actually not in Bangladesh, whole world, the recent data, previously it was in 1 in 6 people. Now it is, the recent data is 1 in 4 people worldwide over the age of 25 will have a stroke. Either mild or severe, that's not a question, 1 in 4 people. That means all the people sitting here, at least 5 or 6 will have a stroke in his lifetime. And that's devastating, that's alarming. So to solve this problem, what we have done, with collaboration with BUET, my friends from BUET, and I'm from Dhaka Medical College, we have made an app. The app has been, this app has been launched very recently in 29 October in Dhaka Medical College premise and the Stroke Day celebration. And this is the link. And if you have a QR code scanner, you can scan it now. I can show you how the application works. I can give you some time to if you're interested, you can go with the link. Algorithm, the basic theory of this app has been taken from the guideline of American Stroke Association. They have developed such an app for their paramedics. Paramedics, I think you already know what is a paramedic. They are the middleman. From a patient to a doctor, they are the paramedics. Those paramedics use this application to rapidly diagnose which patient has a stroke. Because a stroke is a totally clinical diagnosis. You see the symptoms, you diagnose it as a stroke. And they refer to it as a hospital. The similar algorithm we followed, but a bit modified for our Bangladeshi people, and we have made this app in Bengali. If you have opened the app, there is a stroke probability calculator. How this works? It will ask you the same questions. Actually, rogir hat nanate kono durbolata ache ki? That means if the patient is facing any problem to use his or her arm, one arm or both arm, whether he or she is facing any problem to talk, or is there any problem or any facial asymmetry between them. And once the problem is diagnosed, the app can follow the symptoms and can give you a result that the probability of a stroke is 85% or 30% or 20% based on the guideline of American Stroke Association. And once the stroke is diagnosed, then the app tracks your location based on GPS and guides you to the nearest hospital. For example, if I say at 8 a.m., you have faced some weakness in your arm. What you will do? You will say, okay, let's wait. Then you will go to a clinic or pharmacy. I'm having some weakness, what to do? Then the doctor refers to a center where there's CT scan available. And that means there is a referral delay. You need to know why we have CT scan facilities, why do we have multiple injecting facilities. So we will make a data on the stroke centers in Bangladesh, and by tracking the GPS location, it will guide you to the nearest stroke center in the shortest possible time. And the app will also have a knowledge library, how to prevent stroke, how to do the stroke intervention, when to seek help if you have a stroke. And I want to give an example, if you may think how this app will be disseminated in Bangladesh. We all know of diarrhea or cholera. Once upon a time, it was a pandemic or epidemic in Bangladesh. Lots of people died, villages after village got vanished from cholera epidemic. But we all know that if you have a cholera or if you have a diarrhea, just get some OR saline. And so if actually the main challenge is actually he or she will survive.
It is country. Who is going to take? What will be the syllabus?
Epidemic, diabetes mellitus, then cancer, then stroke, then cardiovascular diseases. These are called non-communicable diseases, and they are the silent epidemic. That means these are increasing. Otherwise, the diarrhea or the polio or the cholera, these are decreasing. And that is the new trend in public health. So the key outcomes of the app I have delivered in 3 key points. The app will help you to identify stroke signs early that can lead to a rapid triage. I think we are not all of us are from medical background. The word triage means how to categorize people on the severity of the disease and to help or give medical help immediately. This is known as triage. So this app can help in rapid triage. It will guide where is the proper stroke center, increase the referral delay, and the knowledge library will foster public awareness. And we have a plan to disseminate this app from city level, district level, regional level to the people and to make them aware how to combat stroke, and all in Bengali language, not in English. That means that is easily understandable to the people. And if we see the latest stroke day slogan, it was said, learn the science, stroke, safe, precious life. In Bengali, I can say, জানুন আপনি একটা stroke,
control device all is actually belongs to this part.
And this image is an image of a paralyzed person who had stroke, but a single mobile phone can change this image to that.
We know actually this one, because when people go to the industry, they need actually
not have a lot of facilities. We don't have helicopter evacuation.
Only one
but we all have mobile phones. Using the smartphone, we can save a lot of life, and we can make a difference from a lifetime paralysis to a healthy and sound life. And I'd like to introduce my team members. I'm from Dhaka Medical. The middle two are from Kuwait, and the third is my sir from the head of Diploma of Neurosurgery of Dhaka Medical College. And this is the reference. And I would like to welcome any question from chairs and learned audiences.